So the first thing we're going to do is do a health history, which we've already done, so that'll be in the write-up. The next thing I'm going to do is explain how to do a breast exam. So there'll be 4 different positions for that. They'll be seated, facing me. Also, they're going to put their hands, another position is putting their hands down on their hips, leaning forward, and then their hands above their head. Through this, we'll look for symmetry, looking at the color of the skin, making sure that there's no discharge and no retraction. The next thing we'll do is the lymph node exam, making sure that for the central axillary lymph node that their arm is relaxed, to palpate for that. The pectoral, you'll palpate with the lateral edge of the pectoral muscle to feel that lymph node. For the supra and infraclaviculars, I'll palpate for those. And also the subscapular will be at the lateral border of the scapula. For the palpation of the breast, I'll have them lay supine. And for that, I use 2 to 3 fingers to palpate each breast in a small motion, just kind of for each one, varying the depth for the palpation. Looking also at the nipples for any discharge or any nodules as well. It's normal for the breast to have lumps, but it's not normal for them to have a dominant mass, so looking out for that. So now we'll do the posterior thorax exam. Okay, come back a little bit. You're a little far away. So for this exam, the first thing I'm going to do is inspect the rate and the rhythm of the breathing, which normal rate for breathing would be 12 to 20, and they're looking for any accessory muscles being used to breathe, which there is not. I'm going to assess for chest expansion, seeing if it's symmetrical by putting my hands here and then having him take a big deep breath in and out. Good. So my hands were equal, which means that their expansion is symmetrical. The next thing I'm going to do is palpate around in these areas that I'll be listening to see if there's any tenderness, crepitus, or any masses. Do you feel any tenderness?
No.
Palpate all these areas. Okay. Next thing I'm going to do is listen to those lung areas on the back. Have you take a deep breath. Just keep taking in and out. Okay, the next, I'm going to assess for tactile firmitus. So in this, I'm going to have you say 99, and every time you feel me go like this, you'll say 99. Ready?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, so in that, I'm just making sure that we hear that bilaterally, that they're symmetrical, which they are, and feel those vibrations symmetrically. The next thing I'm going to do is listen to all those breath sounds, which they all were clear. Each field was clear. And let's see, we're going to do one more thing on the back. I'm going to test for bronchophony on the back. So I'm also going to have you say 99 again when you feel me put the stethoscope down.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
And I'm going to have you I'm going to put the stethoscope down again, and I want you to make this noise every time. E. I'll hold the E. Ready?
E, 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 E.
Still doesn't make me turn around. Okay, and then the last one, say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, so for that, testing for bronchophony, the 99 is mumbled, can't necessarily hear it, so that's normal. On the egophony, when he said E, it sounds like an E, it didn't change to an A. On the whispered pectoriloquy, I can hear the 1, 2, 3 is indistinct. So those are all normal. I'm going to have you turn and face the camera now. So on the same thing, I'm going to inspect, making sure no accessory muscles are being used, that the rate and the rhythm are normal, and which they are. Also going to do the same thing. Sit up for me. Take a big deep breath. Checking for chest expansion, which is symmetrical. Making sure that the anterior-posterior diameter is equal to half of the side-to-side, which it is. I'm going to listen to the breath sounds, and then I'm also going to do one more thing on the back side that I missed. Let me listen to those breath sounds first. Big breath. Okay. And the other thing I'm going to do is do percussion for the back and the front. Let's do the front first. So I'm going to start right here. I'm going to sit to the side real quick.
Huh?
Like side, face that way. There you go. And do the same thing back here. Okay, perfect. So the last thing I'm going to do with that, we would do the same test again for the bronchophony, egophony, and the whispered pectoriloquy on the front. And then that's it for the thorax. So we're going to do the cardiovascular exam now. The first thing, actually I'm going to have you lay back on these pillows. Let me fix the camera so we can actually see. Okay, so the first thing I'm going to do is palpate the apical and radial pulses to make sure that they are symmetrical. So find the radial first. which they are equal and they're symmetrical, they're with each other, there's no deficits. The rate is 64, and it's a regular rhythm. The next thing, let me fix that. Hold on, my camera's wigging out. Okay. Next thing I'm going to do is palpate each of the I'm going to palpate for chest wall movement, feeling for any thrills, thrusts, any abnormal movements, which none are present. I'm also going to, while I'm there, listen to all of the heart tones with the diaphragm and the bell. Now I go back with my bell and listen through all those heart tones. He does have no murmurs. S1 and S2 are present, no S3 or S4. While I have this out, I'm going to also listen for any carotid, renal, iliac, or aortic bruits. And no bruits are present. Also going to find the maximal point of impulse, which is right here. It's at with the midclavicular line and the 4th and 5th intercostal space, and it's about 1 to 2 centimeters. The next thing I'm going to do is palpate the pulses, the brachial, let me see that one. The brachial, the radial, the femoral will be right here. Also feeling for the inguinal lymph node while I'm here. Popliteal. Mandibular. And you can see it. And then the pedal pulses.
You can't see it.
It's just too difficult. Pedal pulses. And the post tibs. Tibials. So, I'm also going to assess for JVD, jugular venous distension, by looking up here at 30 degrees. There's none present. And then we'll also assess the hepatojugular reflex by pushing up right here and looking at the vein to see if there's any distension, which there's not, which would indicate fluid overload. Going to assess the lower extremities for the color, if there's any edema, the hair distribution, and the pulses as well, which those are all normal. They're even, hair distribution, symmetrical. The color's pink, normal for ethnicity, and it's the legs are warm. The upper extremities are pink, warm. The hair distribution is equal as well. And the last thing we're going to do is Homan's sign. I'm going to bend up this leg. Right like this. I'm going to push back on your foot. Tell me if you feel any pain in your calf. No?
No.
That's fine. Any pain?
No.
Okay. And let's see, make sure.